Good morning. It is Brian here from the Art of Startup War, otherwise known as Brian from Expert Dojo. Now, as most of you know who listen to this podcast on a regular basis, the reason behind it is very simple. We bring in the entrepreneurs that we have invested in. We are not promoters, we are investors. And I have the pleasure of being able to showcase these great companies. And I do this for one reason and one reason only. And that is that as investors, many of you don't have the chance to diligence, or you don't have the chance to be able to speak to other investors and see what they're thinking. So I take this 30 minutes and showcase the diligence that we have done in the form of interview questions, so you can understand the team, the problems, the solutions, the market size, the opportunity, how much money is being raised, what that money is being used for, how it ties into revenue, and all those wonderful things. And so today, I'm going to continue. We got a great founder, a great company. GeroCare are doing phenomenal things. We're going to dig into the genesis of the idea. We're going to dig into where it came from. We're going to dig into the market and why it needed it so much. So first of all, I want to welcome Dr. Abbey to the show. Welcome, my friend. Good to see you again.
Yeah, thank you for having me.
We're going to have a fun-filled 30 minutes. We're going to talk about nothing else other than creation and saving the world, one patient at a time.
Yeah, my favorite topic.
I know. Take us back. Take us back to the genesis of the idea of GeroCare. Like, where did it come from? What was going through your mind? What made you give up a very fulfilled and guaranteed successful life to step into the shoes of discovery and the unknown?
So thank you, Brian. As you aptly said, I was quite comfortable in my day job. However, a personal experience led me into this journey. So about a few years ago, in the space of 1 year, my father actually had 2 massive strokes. And that was not because there's nothing I could have done. I was simply living and working in another location at the time. So subsequently, my mother called me, told me her blood pressure was high, her blood sugar was high. But there is something she said that jolted me. She said I had neglected them. And like many of us, I thought that was impossible. How could I neglect my own parents? But after closely analyzing my life, I realized that while focused on my business and my career, I had truly neglected this special group of people. It then occurred to me that I was not the only one facing this particular condition, as there are millions of Africans living and working far away from where their parents are. And the only time they hear anything is when something goes wrong. And so we thought to ourselves, is there a way whereby no matter where you are in the world, you could constantly ensure that your parents' healthcare needs are met, and also remind them that you care? And then while digging into this idea, we realized that as a Nigerian, for instance, before you get to the age of 40, there's a 75% chance that you will have lost one or both your parents to untimely death, or have them severely incapacitated by conditions that could otherwise have been prevented. And we thought to ourselves, this is not acceptable. And my co-founders and I decided to launch GeroCare to make it extremely easy for Africans, wherever they are in the world, to subscribe for regular doctor home visits for their parents in Africa using the GeroCare mobile application. And that was the genesis of GeroCare.
Fantastic. And it's a huge move and it's a beautiful story. And one thing is to have the idea, even for incredibly skilled professionals like yourself in the medical space. Another thing is implementing it. So what did you do to bring that to life?
So fortunately, when I had the idea, the first thing I did was begin to run it as an offline business. Because at that point in time, when I saw the need, I started seeing elderly patients myself. And I did that for close to 2 to 3 years. But I realized I was just touching the tip of the iceberg and needed to find a way to get this service out to many more people. Fortunately, at the time, we were exposed to a program called the Ventures Platform Program in Nigeria that were able to accelerate ventures. And so we got into that program, included tech, and were able to scale it to the level we are today. So then I spoke to my co-founders, we built a team, and we're able to develop a platform whereby no matter where you are, you can subscribe for the service. Prior to that point, it was more of a manual thing. People paying me money directly to see their parents, but we realized that was not sustainable and had to infuse tech into it.
So as you developed the platform, what did it become at its most basic form?
So right now is actually more of a cloud-based hospital system, because what we realized was that when you go to a hospital, the only person you really need to see is the doctor. You don't see the pharmacist, you don't see the lab scientist. And so the question was, do you have to be in the same building with them? So what we were able to do was convert the patient's home to a primary healthcare center where the doctor appears in the house connected to everybody else you need. So similar to a typical consultation, you see the patient, you collect the patient, you examine the patient, but instead of writing a physical prescription, you make a request on the app, and then we deliver the request to the patient at home. So if you need drugs, you make a prescription request, it goes to our pharmacy network, we deliver to the patient at home. If you need tests, you make a request, it goes to our lab network, and we deliver the services to the patient at home. So they receive the exact same care they will receive in a clinic, just that is taking place in the home, with the added benefits of the elderly person not needing to make a payment at all, the child making the payment from wherever he is and able to follow real time on what is going on.
So can you tell me, like in every entrepreneur's journey, there are obstacles that come up which are incredibly difficult and they just like ding you in the face all the time at the start. Talk to me in the early days as you were developing this, some of the most challenging and difficult things that you had to overcome.
So there are two things that come to mind readily. One is the health-seeking behavior of Nigerians, and I think Africans in general. I'm not sure about the rest of the world, where they always wait until something happens before they decide to seek for medical attention. And so we had to battle with changing that mindset and getting people to subscribe to the service even before the elderly parents develop an illness. Because what we tell them is that when you sign up, if we get there and the person is in good condition, that's the perfect time to start. And so we ensure the person never gets to the point whereby he needs care. However, if we get there and there's something, it's also good because we got there on time. But if you wait until a situation arises, especially for the elderly, it's extremely difficult to get them back to optimal condition. And so we needed to educate the market to help them understand that they should not wait until something happens before they come on board. And that was a key challenge we had, getting them to understand these things. Because initially, people always said, but my parents are in good health, but my parents don't need it yet. Yes, that's the best time to start. So get them to understand that for the first time.
Yeah,
The second is,
we are, look, just on that point, like we are idiots, aren't we? Like we're just idiots in how we think. I even think back last week, I had a really bad toothache. And I went to the dentist and I was like so fortunate they didn't pull out my teeth, but like so fortunate that I didn't pull out my teeth. So we wait till we have a toothache until everything is like destroyed. And then we think, hey, it's a good time to go to the dentist. No, it's not. It was a good time to go to the dentist to avoid having a toothache, to avoid having an infection, to avoid having your damn tooth taken out, you stupid Irish idiot. And so, yes. And it makes so much sense when you say it. By the way, before you get to the second barrier, in many ways, I don't even think of you when we were making the original investment. I didn't and don't even think of you really as a platform that allows for children to be able to pay to make sure that their parents are taken care of. I just think that's a really nice part of what you do. I think of you as a decentralization of a healthcare system, which can never work centralized. It just can't ever work centralized. It's too hard. So you allow for people to get the very basic thing that they need, which is that healthcare can access them to keep them healthy so that they can live long and happy lives. Like that should be our baseline. This isn't the luxury, people. This should be the baseline of what we should get in our healthcare system. And the only way that this is ever going to work is in a decentralized way, whereby every single thing can be accessed and sent to you from what you need from wherever it is. I think it's like just such an incredibly important part. And that changing of behavior is really important because when we do this badly, you can't fix it. you don't get a second chance at life. Once it's gone, it's gone. And the only thing you're going to be filled with for the rest of your days is regret. So you really, your message is so important that we stay really strong on that with people to help them avoid going through the challenges they have and give them the wake up call that you were privileged to be able to get and say, wow, I still got my parents. They're still in good shape. I now can take care of them and they can actually have that decentralized care that they need. What was the second really big barrier that was up against you?
So the second was more of a trust factor because we are actually going into these people's homes. So for instance, you're not in the location, but you're signed up to a platform and inputting your mother or father's home address, who are already vulnerable as elderly people. You are now putting the information to a platform whereby you have no idea who the people on the other end is. So we needed to get the trust factor up to make sure people trusted us enough to be able to allow us get into their homes. So in the outset, what we did was leverage on already existing communities. So we started with the churches, for instance, whereby we leveraged on the trust of the church for them to understand that if the pastor or the owner of the church can allow us to come and speak to them, we ride on his own credibility. We also had to partner with a lot of already existing agencies like well-known HMOs. So they already piggyback on the level of trust people had in them to get us into their homes. I remember in the beginning, while signing up, a lot of people called us in between the sign-up process just to hear our voice and understand us and know who it is they're feeding their parents' information to. And so that initially was also a key barrier. But fortunately, we are surmounting that right now. Many people already know about us. A lot of our partners are well-known partners. We've been endorsed by the World Health Organization. And so stuff like that is able to give people more trust in us and know that we can do what we say we can do, especially because we have about 11 to 12 international awards right now in innovation. So you Google us anywhere, you understand that we're who we say we are. So fortunately, that's not much of a problem at this point in time.
Wonderful. And for those folks who don't know, and you got to be hiding somewhere on an island not to realize this, Africa is about to become the most dominant region on the planet. And we're not just talking about like fastest growing middle class. We're not just talking about youngest population. We're talking about size of population as a percentage of global population. We're talking about up to 25% of global population within the next 10, 15, 20 years. So this is something that's happening right now. The size of the market is absolutely enormous. The need for this is absolutely huge. The economy is growing on the middle class level who are going to use this the most. And then the more people that can use it on the middle class, the more then that can actually then be brought into people who are at a far higher poverty level, but they need it equally as much as well. Like this really is about saving Africa through healthcare and providing it in a way which is entirely decentralized, which I love. Talk to us a little bit about how the team has developed over the last couple of years. And then I want to dig into the traction and how you've gone forward with the traction. But let's start with the team first.
So I lead the team, the co-founder and CEO. I've been a doctor now for over 2 decades. I started my career in the public sector in the teaching hospital in Nigeria. After that, I traveled for my master's in business, came back, was made a medical director of a state-owned hospital. Then I was moved to the head of medical services for the state-owned health insurance scheme before I left to build and grow GeroCare. And my co-founder also was my college roommate. So we've known ourselves now for over close to 30 years. And we've been working together closely on various things. And he also, is a specialist in what he does in healthcare marketing. He started his career in health insurance and then built and grew on that level also. He also diverted into academics for a little while. He was an acting VC for a university, director of academic planning, and other such activities. Our CTO has also been building software now for about 20 years. And he also owns a hub for tech talent in Nigeria. So the team has been working together quite closely and have been able to, balance each other's weaknesses and strengths because we are all strong in certain areas. I'm strong in medical practice, the product side of things. Dr. Ajibola, he is the hustler, he is the seller, he's the marketer, he's the marketing side of things. And we have our tech co-founder who is doing quite well in what he does.
Beautiful. And then as the team is going to grow, talk to me about how that will happen in parallel to the traction of the company. So let's talk to what's happened over the last year or so with regards to traction, growth, users. Talk to us about how that's going to grow alongside with the team growing, and then talk to us about investment and how you will need investment to facilitate that growth.
Okay. So as regards to traction, interestingly, we grew over 2x year on year for the first 3 years, then
Nice.
grew over 5x for the fourth year. Interestingly, the last year has also been quite good in the sense that we are growing at about 2x over the previous year. And interestingly, because of that, there are certain opportunities that have arisen. So initially, it was more of a B2C thing, but as our network increases, a lot of corporations have come into play. So right now, corporations are coming on board and leveraging our service for the staff to enable them provide care for their parents, especially multinationals. So that has been an interesting twist, and that's how this year has been going, especially because we hit about 5 years last year. And with that, we're able to make the noise we needed, involving influencers and increasing our attraction markedly.
I love it. And by the way, we're going to finish on a question which I always love asking, which is that I want you to move yourself 10 years in the future. You're on Bloomberg television. They're interviewing you after an amazing exit. And you're going to talk about what you sold the company for. You're going to talk about what the company became. You're going to talk about the breadth of the product. You're going to talk about the countries that you managed to expand into. You're going to speak to a company 10 years in the future for everything that you achieved in the meantime. But before we get to that, speak to us a little bit about how much money that you're raising right now, and talk to us about what impact that's going to have on monthly revenue, and monthly users throughout the rest of 2023 and 2024.
So right now we're raising $1 million, and we expect that this will help us grow at least 3x monthly for the rest of the year if the money comes in when we expect it to, especially because we've understood what works and understand what levers to pull. And especially because most of the beginning processes have already been done. Right now, we are just gung-ho on customer acquisition, increasing our number of users, which the money will help us go a long way in.
Okay, wonderful. And if I was going to hold you to specific numbers later on this year, how do you see that growing? What kind of numbers would you throw at me?
So interestingly, over the past few years, we've been able to hit about 150,000 users. And we expect that by this year, we should at least double that number or triple that number. So that'll be about 450,000 users. Also understanding that these users pay for multiple visits. So a user, for instance, can make a yearly subscription. That's almost 12 times the number of users on the platform. So that's how we look at it. By the end of this year, we should hit at least 500,000 users based on the way we are going, if we get the investment we need.
I love it. And how can people contact you, by the way?
So we can send an email to us, direct us at gerocare.org. That's DIRECTORS, directors at GeroCare.org.
Very smart. Okay. Last question. This is it. 10 years in the future, Bloomberg television, big interview for them, not for you. They're talking about what you built, what it became. Tell us what you say.
So I see us being the Amazon of preventive digital healthcare across Africa, beginning first with doctor home visits, and then moving on to telehealth, the wearables, and Uber-type care for the elderly, whereby people nearby can provide care for their parents through us. So the idea is that anything regarding preventive healthcare in Africa, GeroCare should be the go-to person for it.
I love it. Fantastic. And what did you sell for? Or did you IPO?
Right now, thinking into the future, at least 10 billion.
10 billion. I love it. That's a good number. Listen, it's been a pleasure investing in you. I love being a part of such an important thing that you are doing in Africa. The fact that you're saving the lives of millions of people is tremendous, and I absolutely adore the fact that we've had the chance to invest in there. As always, with all investors who are listening to this, you are all welcome to always outreach to me at brian@expertdojo.com. As always, I am not suggesting in any way that you should invest in anyone. I am merely saying that we invested in this fine human being and this incredible company, and we are incredibly happy that we did so. So if ever you want to get any information, I am here for you. Thank you, Dr. Ebby. Thank you for what you're doing. Thanks for allowing me to be on the journey with you, and congratulations on everything you've done in GeroCare.
All right. Thank you very much for having me. It's a pleasure being here.